Hey, everybody out there that is suffering, we got a special guest today.
Fran Sullivan.
Fran Sullivan. She even gave me her last name. And Fran, how old are you?
I'm 70 years old.
70 years old young, right?
Yeah.
At least now, anyway.
Yeah, I feel better.
Yeah, that's awesome. So just tell the people out there that are suffering, what was life like before you started functional medicine? Like, how bad were you feeling?
I was feeling just listless, tired, all the time. No energy. Even if when I wake up, it was just a drag to get up and go to the bathroom and go sit in the kitchen. I had no energy to go do anything.
Like, when you say a drag, like, what does that, like, a drag, like you had no energy to move, or you just, like, felt like you just had to sit on that?
Yeah, you had to go sit down. Yeah, you have no energy to, get up and go do something active.
Zero energy.
Yeah, zero energy. That's what I had.
Okay, and you're like an active grandma.
Yeah.
Yeah, right? You're actually tiling your grandson's bathroom now, right?
Yes.
Okay, at 70.
Yeah.
He's 28. You're 70 tiling the bathroom.
Yeah, he's a big baby.
Okay.
Big fat baby.
Okay, so now, just tell people out there, because there's a lot of people that are suffering with like constipation problems. Before you started the functional medicine program, like, how bad were your bowels? Like, how often were you going poop?
Oh, about every 3 days maybe.
Every 3 days?
Yeah, and straining, just terribly constipated, yes.
And you said you'd actually sometimes get a hemorrhoid, right?
Oh, yes.
Because it was that bad.
Yeah, I lived in fear of going to the bathroom because they don't know if a hemorrhoid's going to come out,
Yeah, that's no good.
Yeah.
Yeah, that's horrible.
Yeah, and I was very careful not to eat spaghetti, bread, anything with flour in it,
And if you did eat those things, how often, if you ate, let's say, bread or spaghetti...
Yeah, the next day you're suffering.
Yeah, okay, so the next day you're suffering like you had. Describe that. Like, what was it like to suffer?
You feel like bloated, you feel big, like you have to go, but you can't go.
Uh-huh.
Yeah.
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 And, go ahead.
Yeah, there's no, it won't come. You want to go, but you can't.
There's like no relief.
Yeah.
Yeah.
No relief.
Right. And then you also mentioned when you'd have bread or something bad, like you would go once every 5 days. Is that right?
Oh, very, very common to go 5 days. Yeah.
Yeah, and that's not normal at all.
No.
So how often you going nowadays?
Well, I'm going too often now. I'm going about 3 times a day.
Okay, so here's the lady. I just want to clarify that for the people that are out there suffering is, she says too often, but 2 to 3 times a day is what's actually normal, healthy, bowel movements, right? So she just,
I didn't know that.
Yeah, she just didn't know that.
I thought maybe if you went once a day, you were lucky.
Yeah, well, 2 or 3 is normal. Now you're going 2 or 3.
Yeah.
Yeah.
No, I don't want to be too far away from a bathroom. out in the woods or something.
Okay. So tell people about like your brain fog and like your memory.
Oh yes, definitely. I can tell that I'm not quite so absent-minded and doing foolish things.
Mm-hmm. Do you feel like you have a clearer mind then?
Yes.
Yeah.
Yes.
Okay. Great.
Yes, I can tell the difference with the supplements that I've been taking in a short time here, 2-3 weeks.
Yeah, you've only been on our curriculum for how long?
It's 2 or 3 weeks.
2 or 3 weeks, yeah.
It's got to be about 3 weeks, maybe.
Yeah, I would say about 3 weeks. Now, one thing I have for all the people out there that need help, I have a whole whole online education. I call it 𝗪𝗵𝘁 University, and I had you watch about 4 or 5 videos. And what were some of the takeaways that you got from that?
Oh, a lot of things. I did not know that the other foods that I eat besides sugar turn to sugar. In your body. I didn't know that your brain needed this fats and stuff like this.
Yeah, right, yeah.
Yeah, I didn't know that all this stuff affected your brain, and your brain is what controls everything in your body, all your organs and everything like this. Yeah, this is quite educational.
Yeah, right. And you're 70 years young, and like no doctor's ever explained any of this stuff to you.
No. Doctors are very disgusting.
Yeah.
They don't tell you nothing.
Yeah. And all they want to do is give you some drugs.
They want to give you some pills. And I just happen to be one of those people that have a high sensitivity to anything they give me. Just about almost everything they give me, I have side effects and can't take it.
Yeah, right.
It's been an issue to get a blood pressure pill that works, and what else they try to put me on? Cholesterol medicines. I ended up from a statin, one pill in the hospital for a week with an ileum, with my guts
Something
cut
bad
open.
GI. Oh, it was a surgery.
I went into convulsions from one statin pill.
Yeah, it's crazy.
Yeah.
Wow.
One pill
Yeah.
put me in the hospital like that.
Shame. So, percentage-wise, what would you say that you've improved in a matter of 3 weeks? From 0 to 100, this is Fran's scale.
Yeah, I'm saying 40%. I got more energy, and this is just a few weeks here.
Yeah, right.
I mean, right now, I feel like I could go out and hop on my bike and go for a bike ride.
That's awesome.
Where I couldn't hardly drag myself into the kitchen here about 3-4 weeks ago.
Yeah, that's great.
Yeah, that's true.
And, you know, at the end of the day, you came to one of my workshops.
Yeah.
That's how you...
I've came to a couple of them now. Yeah, I seen it in the paper, in the newspaper, about thyroid. Because they said I had thyroid trouble. So I told my daughter, oh, let's go to that, see what they say, you know.
Yeah. Okay, well, great. What would you say to any folks out there that are watching you and, you know, they're kind of apprehensive about, you know, what we do is what we call functional medicine.
Yeah.
What would you do to any people out there that are like, well, they don't think it's going to be for them, or they don't think that they're going to get results, or they just have some questions or concerns about it? What would you say to those people?
I say, do yourself a favor and go check it out. By all means. I mean, doctors don't tell you anything. They don't explain things to you. Go educate yourself about this diet stuff that we're eating, all the things that are bad for us.
Yeah.
Diet
and the specific supplements, which are specifically, you know,
Yes.
for your
body.
for your body and what the blood works.
Yeah, you're not getting the minerals and stuff that from whatever you're eating that you need.
Yeah.
Yeah.
Well, great. Any last words you want to say to anyone that's watching out there and is watching this video in agony and suffering and is just taking drugs?
Oh, yeah. Yeah, the drugs that the doctors are giving are just masking the problem. That's the problem. You have to get the stuff in your body that's making your body work correctly. You know? Yeah. Right. If you have a big lack of minerals or something like that, they're not doing anything for that.
No, they're not. Yeah. They're just, you know, giving you drugs and hoping you go away.
Yeah. They give you a statin to, I don't know what, take cholesterol out of your body when you need the cholesterol.
Yeah, right. That was in one of my videos.
That was one of the things I learned. You need the cholesterol for your brain and everything else. And I knew already that cholesterol makes people ache. It's no wonder old people are going around,
because they're all on statin medication.
Because they're all on these,
cholesterol.
They're pushing these statin medicines. I mean, you don't want to take it. Oh, yeah, you should take it. They talk you into it. They want you to take that.
They tell you you're going to die without it. Have a stroke or a heart attack or something.
Yeah, that's what they say.
Yeah.
Well, I don't believe that. Yeah, you have to, don't take that cholesterol medicine. I know someone that was on a pill like that, so weak and so, the muscles were so bad. He fell down. He was falling down at work.
Yeah, that's crazy.
Like 62 years old. Yeah. And I seen it on TV about statins make your muscles hurt. I told him, stop taking that pill and see what happens in the next month. Yeah. Guess what?
Better.
It was the statin pill.
Yeah. Well, ladies, take it from Grandma Frances, who is now tiling her grandson's bathroom, who's 28 years old, and Grandma Frances here is 70, tiling that bathroom. There's no way that you would be tiling that job without the functional medicine.
No.
Maybe you can come over and tile my place. What do you think that? You're gonna come over and tile my place.
Oh, I need to retire
soon. Okay, well, take care, everybody, and I hope you found this very interesting.
Thank you.
Bye-bye.